This is a terrible, terrible result for anywhere in the United States. What's broken down? There are people who cannot get treatment, people who run to the end of their treatment, who end up traveling back and forth to New York to get drugs. If this was happening on the mainland, it would be a scandal. It is a scandal. What's going on with Puerto Rico? Francisco?
I think it'd be short-sighted to just point out, I think there's just the HIV issue and the epidemic. I mean, I think Puerto Rico, unfortunately, has a lot of challenges, a lot of infrastructure challenges, because, you know, there's some provisions that there's some, you know, Medicaid that they don't get the full amount if you were a state. And I think it's the status issue. I think there's a lot of conversations that happen from Puerto Ricans that come to New York, or they are now going to Florida or the South. I think there's a lot of challenges around also transportation. So we have the large metropolitan cities, San Juan, Ponce, et cetera. But then you go on the outskirts, you know, there isn't that services out there as it needed. I think it's just an infrastructure issue. I think there's some challenges politically. I think just historically, Puerto Rico has been very political. And so every time there's a change of party, I think there's some challenges there in terms of the services that are being allocated for the health departments or for the community-based organizations. And so it's larger than just, you know, why aren't folks getting tested? Why is it an epidemic? I think there's kind of a systemic issue there as well.
Well, there's a disproportionate problem on the island with diabetes and hypertension too, but nobody would say, oh, it's tough to get around the island, so we can't get you insulin, or we can't get you your high blood pressure medication. It almost, I don't get it. It's only 100 miles wide by 35 miles deep.
But I want to remind you that a lot of times, even here in the States, folks who are HIV positive and getting their services don't go to their community center or next door neighbor in their neighborhood. They travel because of the stigma. And so that same issue happens in Puerto Rico. So if you may live in San Juan, you may not want to get your services in San Juan. So, you know, because of the issues of the stigma of who's going to see me walk into the clinic, that kind of thing. And so I think that, you know, if you have diabetes, I don't think there's that issue. I mean, you're going to go to a clinic that's in your community, you're going to be able to walk there potentially. And so there's some other issues beyond. I mean, I think we can't just focus it on, like, you know, comparing it, because you can't compare it's apple and oranges.
Could I add something?
Sure, please.
Until recently, the island of Puerto Rico wasn't counted in the statistics with the general Latino overview of what the epidemic looked like. And so I think that has a lot to do with understanding what the reality of the HIV epidemic is on the island. We didn't have a clear picture until recently. Puerto Rico was just included. And so that has a lot to do with funding streams as well. The infrastructure is not Puerto Rico to be able to serve as many people that are positive and to address the ways that people are getting infected. And so as a result of the infrastructure not being set up and the financial streams not coming in, you know, you'll have such a scandal, as you mentioned.
I do want to point out too that in line with the National HIV and AIDS strategy, CDC put out a funding opportunity announcement to really look at enhanced comprehensive HIV prevention planning, and Puerto Rico is one of those jurisdictions. And I think to what Liliana pointed out to, I think going through that exercise and really being able to understand the epidemiology of what is happening on that island will really help them a lot in being able to underscore not only where the epidemic is and how it's being transmitted, like you talked about earlier, but really then how to really look and direct some services and be applicable for some of the resources that are out there based on that epidemiology, which I think will help them a great deal.
Well, that part about not being counted with the general statistics, I think illustrates part of the problem with Puerto Rico being in the United States but not in the United States. Part of the United States but not of the United States. It has a wide degree of autonomy and its own national health care system, but at the same time isn't part of it. It's not the same as Pennsylvania. And so probably at HHS, it's not quite like other states of the Union, but it's not quite like Venezuela either. It's in this weird middle category. And the fact that HIV is so heavily transmitted from intravenous drug use shows a problem with the addressing of that problem as well. Are there needle exchange programs on the island?
I believe there are. I don't want to say it, but I know that there are some challenges in, like Puerto Rico and other jurisdictions, where there's local provisions that prohibit, not provision, local ordinances that prohibit the use of federal exchange programs,
Needle exchange
needle
programs.
exchange programs. And so I think Puerto Rico also has had issues, even though that in books you can have these programs in place, it may not always be acted out in terms of kind of police harassment, again, stigma in the community of like, I don't want that center in my community, in my block. And so, while there are legally, they could have the issue, you could have the services, it may not always act out as you would think it would.